The term mental disorder or psychological disorder refers to mental processes and/or behavior patterns that cause distress and substantial impairment in a person's functioning. They often include the presence of one or more maladaptive behaviors. And these maladaptive behaviors are behaviors that just make it difficult for the person to function, to adapt to environmental challenges, to meet those everyday demands. And these maladaptive behaviors oftentimes will cause substantial discomfort, disability, and a loss of a person's control over their thoughts, behavior, or feelings. A similar term would be insanity, but insanity is a legal term. It's not a psychological term. So the term insanity only really has any usefulness in a courtroom, and it refers to an inabilities to a person's inability to manage their affairs or foresee the consequences of their actions. If you're judged insane in a court of law, then you will not be held legally responsible for your actions. And if you are judged insane, then you can be sent to like a mental institution and be required to, see psychiatrists and counselors and things like that. But I just want to be very clear that when you're judged insane, that doesn't mean necessarily that you have a mental disorder. So mental disorder is completely separate from insanity. Now, the way we determine what mental disorders a person might have is by using a textbook, the Diagnostic and Statistical Manual of Mental Disorders. Now, we're currently in the 4th version, so DSM-4 TR. TR stands for text revision. And this textbook is used by psychiatrists and psychologists and all kinds of mental health workers to, just classify all the different disorders a person can have, what are the signs and symptoms, and it even goes into a little bit of detail about, potential treatments. The DSM has many different classifications for many different kinds of problems. Here are just the major categories of disorders. The first is disorders that are usually first diagnosed in infancy, childhood, or adolescence. So this would be things like mental retardation, learning disorders, behavioral disorders, and so on. The second major classification would be delirium, dementia, amnestic, and other kinds of cognitive disorders. Third, we have mental disorders that are due to general medical conditions but not classified anywhere else in the book. Fourth, you have substance-related disorders like alcohol-related disorders, amphetamine-related disorders, hallucinogen-related disorders, and so on. Next, there's schizophrenia and other kinds of psychotic disorders, followed by mood disorders like depression and bipolar. And then the next classification is anxiety, and that's followed by somatoform disorder, factitious disorder, and dissociative disorder. Then there's the sexual and gender identity disorders, and we've talked about many of these already. These would include things like paraphilias and sexual dysfunctions. Then there's eating disorders, and we've talked about some of those as well, like anorexia and bulimia. Then there's sleep disorders like dysosmias and parasomnias. And then there's impulse control disorders that are not elsewhere classified in the book, and adjustment disorders and personality disorders, and then a category of other kinds of mental health conditions that aren't really talked about in other places of the book. So there's many different kinds of problems a person could develop that are discussed in this book. But in general, every single year about 26%, or about more than 44 million adults, are diagnosed with some kind of mental disorder. So that means about 50% of Americans will be diagnosed with a mental disorder at some point in their lives. So it's extremely prevalent. Mental disorder is something that is extremely common. It's very likely that you yourself will be diagnosed with a mental disorder at some point in your life. So you should really just keep that in mind and take it very seriously that mental disorders are a very serious and widespread issue. And these mental disorders that people contract represent not only personal misery, because it does cause great distress for people who are suffering from mental disorders, but also when people you know contract these disorders, it can cause a major disruption in your life as well. So even if you're not the person suffering from it, you could still be affected. Just imagine, for example, that you are the boss of some company and 50% of your employees have serious mental health issues. That's going to represent itself as, major effect on your bottom line. You are not going to be as productive. You are not going to be as efficient as you would be if it wasn't for these mental disorders. So just as a society, we should take mental disorders very seriously, and the treatment of mental disorders very seriously. Some people have a higher level of risk of developing a mental disorder than others. These people generally have one or more of the following factors. They could have biological factors, like certain kinds of genetic mutations that increase their risk, or for many disorders, there's actually genetic predispositions. So you could inherit a predisposition for something like depression from your parents. And then there's other kinds of biological things like poor prenatal care, exposure to teratogens, head injuries, chronic physical illness, and so on. Then you have psychological factors that increase your risk, like having a low intelligence. So a low IQ score is definitely related to developing mental disorder. Being chronically stressed, having various kinds of learning disorders. Those can also significantly increase your risk. Then there's a whole list of different kinds of family factors. So just living in a household that is, unstable, having immature, mentally ill, or abusive parents, having inconsistent or just poor disciplinary, schedules. And if the parents are going through some kind of severe marital or relationship problem, that can also significantly increase the child's risk. Then there's various kinds of more mainstream, more widespread social factors, like living in poverty, being homeless, being overcrowded, having very stressful, social living conditions. And all these different risk factors, if you have many of these, then that's going to significantly increase your risk. And the way we talk about how disorders are developed is in regard to what's called the Diathesis-stress model of psychological disorders. Sometimes we call it the stress vulnerability model, but here's what it looks like. So all these different factors, biological factors, social factors, all of those combine to form your diathesis. So we could just break that up into your genetic predisposition and all those other factors. So those things combine to, basically set how vulnerable you are, how likely you are to develop a psychological disorder. So each of us has our own level of vulnerability for various kinds of disorders, and if we're pushed hard enough, we could develop a psychological disorder. So somebody, just for example, I might have relatively high vulnerability to some particular disorder, but somebody else could have a very low vulnerability. So while it would require a massive amount of stress, while I'd have to be extremely stressed for a very long time to, snap, somebody else, it's just like a short little push. You just have to kind of, slightly inconvenience them and they just go overboard. So everybody has their own level of vulnerability to various kinds of disorders. The way we think about and talk about psychological disorders and modern treatments for those disorders is in regards to the biopsychosocial approach. So the biopsychosocial approach just takes into account those three factors. The biological factor, things like genetics, hormones, and so on. The psychological factor, so your thoughts, your emotions, all the other psychological stuff. And the social factor, like your friends and your family. So it's the combination of all these different factors that we can use to better understand what's going on with a person in regard to psychological problems. Before I go into detail about any particular disorder, I just want to say a few general things about the DSM. First of all, the DSM, it's not perfect. It's gone through a lot of revisions over the years. We're currently in the fourth version, and the fifth version is going to come out soon, and we're going to see some interesting changes in that. But just as an example, I think it was the DSM-3, but up until 1973, homosexuality was considered a disorder in the DSM. So you could diagnose somebody with the mental disorder of being homosexual up until 1973. But clearly, things have changed, and things will continue to change, and the DSM will constantly be revised. Some things that you can expect to see in the newest version would be things like post-traumatic embitterment disorder, apathy syndrome, and potentially internet addiction. But when we look well into the past, when we look way before the first DSM was drafted, what we see is that people have used psychiatric terms not always for the best reasons. Historically speaking, we have described different kinds of mental illnesses that nowadays just seem silly. But when you really look at the culture at the time, when you look at what was going on in the society, what you see is these behaviors that were considered mental illness, they were really just socially unacceptable or socially unwanted behaviors. For example, in the history of the U.S., we used to use the term drapetomania, which was a mental disorder that causes slaves to run away. It's a mental disorder that causes slaves to want to be free. Just think about that. That sounds ridiculous, but back then, a lot of people truly believed that if a slave wanted to be free, there was something wrong with them. That's clearly ridiculous. Another one that was talked about to great extent in the past was anarchia, which is a mental disorder that it's like a form of insanity that leads people to want a more democratic society. I think nowadays we all suffer from anarchia, but back then it was a serious problem. Now, if you do get a copy of the DSM and you look through it, what you'll probably find is that you fit the classification for almost every single disorder. This is a serious problem that a lot of students face. It's called medical students' disease, where if you know what the symptoms are, if you know what the signs are for these various problems, you'll quickly realize you have all those signs and symptoms. So it can be a bit frightening. It's like, wow, I have schizophrenia, I have bipolar, I have various kinds of anxiety problems. It's like you're just a bag of issues. And it's really, it can be really frightening. But I just want to give you a word of advice. If you do buy the DSM and you do notice that you seem to have a lot of these disorders, let me remind you, it's not really a disorder unless it causes significant impairment in your life. If you do fit the description for something like schizophrenia, well, I would say that's probably not a big deal if you can live a perfectly normal life and you can maintain perfectly normal friendships. If your schizophrenia is not affecting you really, then you don't have much to worry about. I wouldn't really consider it a mental disorder unless it causes a problem for you. The last thing I want to say before we get into any specific kinds of mental disorders is that most of these disorders will cause significant, unhappiness for the individual. And that could then lead the individual to commit suicide. So I just want to say a few things about suicide. First of all, we know that men are more likely to complete suicide attempts, whereas women are more likely to make suicide attempts. So you could say, with regard to that men are more efficient at killing themselves. When it comes to ethnicity, we know that certain ethnic groups are at a higher risk than others of killing themselves. The groups that are at the highest risk would include Caucasians and American natives. When it comes to a person's age, we know that, in general, the older you are, the higher your risk. So, children and very young adults, they're at a relatively low risk. But as you get into your 40s and 50s, it's just going to keep going up and up and up. It'll, for most people, it'll kind of flatten out, though, at around 60, and it actually starts to go back down again. And the reason for that seems to be that, when you're that old, it takes too much effort to do things like this. It's just, you're kind of tired. It's not really, something that you can bring yourself to do. And then, lastly, we know when it comes to your marital status that people that are in a happily married relationship for a long period of time, they tend to have significantly reduced risk, whereas people that are single, widowed, or divorced have an increased risk. And other risk factors would include things like a person abusing drugs or alcohol, having depression and various kinds of mood disorders, having easy access to a firearm of some kind. Like the research has clearly shown, and there's lots of studies on this, that simply having a gun in your home will significantly increase your risk of suicide. If you suffer from severe anxiety or panic attacks, if you have a family history of suicidal behavior, if you've recently experienced some form of shame, humiliation, failure, or rejection, if people who make direct threats to commit suicide are clearly at much higher risk, if somebody has a preoccupation with death and dying, if they show a lot of anger and rage, or they're seeking revenge for something, if a person shows a lot of aggression and like unusual risk taking, if they seem to withdraw, so if they seem to like isolate themselves, if they show like a sense of nihilism, like they feel like they have no purpose in life, if you notice that the person has like sudden mood swings or personality changes, like major personality changes, if they start giving away their prized possessions, like things that they would never want to part with, or if they have some recent occurrence of some severe trauma or emotional shock. So that's just a list of all the different things that you should keep an eye out for, because these definitely increase the risk of a person committing suicide. Now, if you notice these signs that I just mentioned, if you notice these kinds of warning signs or risk signs in either yourself or somebody else that you know, then I want to strongly suggest that you do something about it. You don't need to be a hero. All you need to do is recognize that this person is at an elevated risk of suicide, and you need to try to have some kind of crisis intervention. You need to just kind of direct the person. Sometimes you need to literally hold their hand and take them to somebody that can help them, somebody that can talk to them. Maybe you just give them a phone number for a crisis center, or maybe you take them to a clinic of some kind. Just do something, because the consequence of your inaction could be deadly.